News: kidney stones are one of the most painful and common reasons people end up in the ER. Now University Hospitals is launching a first-of-its-kind stone clinic designed to diagnose, treat, and even prevent kidney stones all in one visit. Senior health correspondent Monica Robbins is in Studio B with more. All ears on this one, Monica.
Oh, I bet, Dave. Yeah, thanks. And did you know nearly 500,000 people go to the ER every year due to the pain of a kidney stone? Joining me now is Dr. Jose Salvato, who is the new division chief of stone disease at University Hospitals. Thank you so much for being here.
Thank you for having me.
So the new clinic is going to be at the Ahuja Medical Center.
Yeah.
Why was this so important?
Yeah, the location is very important because we are trying to find the right place for the right people. So there we can see men's, women's, kids, and the idea is to see the patient as a whole. Surgeons are very used to treat the stone and don't get concerned about the rest. And now we're trying to see this chronic disease as a whole thing.
So how will the clinic work? If you have a kidney stone, I mean, obviously, if you're in a lot of pain, you're going to go to the emergency room, but that could be anywhere. How would you end up in this clinic?
So normally, this clinic works, the general physician refers the patients, and then we're going to see the patient along with the nephrologist and the dietitian, which is a very important part of this disease. So the idea is to see like a 360-degree approach. So take care about your chronic conditions, the stone itself, and the diet too.
Why is diet so important when it comes to kidney stones?
Yeah, you know, around 80% of times, diet is related to the genesis of the stone. So in 80% of time, we will have to change the diet to modify certain factors that increase or can reduce the risk of kidney stones.
Is there anything people should not eat because they cause kidney stones?
There's some food that is increase the risk. For example, sugary drinks, salt, some kind of meats, and especially people have to drink more water.
So I learned this, that, you know, women don't get them as much as men, but when they hit menopause, they're at much higher risk. Why is that?
Yeah, they tend to get a risk around 30 to 40% increase. And that's why, because hormones give some influence over your protective factors. So there's some imbalance in the minerals that you get in the urine when you get menopause. So that's why they are more common.
So a lot of people just think, oh, kidney stone, it's going to cause a lot of pain, but can they be dangerous?
Yeah, sometimes if you get your kidney totally blocked because of a stone, you can finally lose your kidney. Eventually, you can have acute kidney injury and chronic kidney injury. So it's very important to treat the stone, especially if they are blocking the kidney.
Are there any early symptoms that might alert you that, hey, you have something going on
Yeah,
here?
depending on the age of the patient, and sometimes you can have mild symptoms, and sometimes you can have severe symptoms. Mild symptoms can be just some blood in the urine, some burning sensation, some urgency, that sometimes they are mistaken like it was, you know, like a bladder or gynecological issue. But you have to be aware, especially if you are facing those kind of symptoms.
So bottom line, is this clinic open already?
Yeah, this clinic is open, and we are happy to receive all the patients that wants to see us. And as I said before, we're very focused in trying to see the patient as a whole, considering their chronic conditions, how many stones you have in the past, what is the right approach to your stones right now.
So this is one-stop shopping to deal with your kidney stone. And can you get treatment there as well?
Yeah, normally if the patient needs surgery, we're going to find a slot for doing the surgery in the same place.
And if not, they ultrasound, that sort of thing?
Normally the diagnosis, we use more CAT scan than ultrasound. Ultrasound is more for pregnant women and kids. The CAT scan is our gold standard to get the diagnosis of a stone, because with that we can know about the location, the position, the size of the stone.
Okay. All right. Dr. Salvato, thank you so much. Dave, you're right. I think a lot of people are very happy to know that there's options out there now.
Absolutely. Great information. Monica, thank you.